Whenever you are.
Hi. Marianne asked me to present a safety story, and I didn't have a specific incident, so I just thought I'd highlight the training that we've done over the last few years between the VA Police, Veteran Justice Outreach, and CEPC. Prior to coming to the VA, I had no idea of all the resources were available for people in crisis. So this program was started many years ago with Courtney Slade in the VJO, and we've just taken it and expanded it to the local and national first responders. We partnered up with the national program outside law enforcement, first responder, suicide prevention training. This program is designed to assist community partners in getting care for veterans in crisis. The team has presented throughout VISN 2, Huntington Beach, California, Las Vegas, and Fayetteville, Arkansas. What the police bring to it is we give insight to successful de-escalation strategies to our community partners when dealing with veterans who are in crisis. This fiscal year, we've trained 563 first responders in 62 agencies. Since March of 16, we have trained over 2,700 first responders. This accounts for over 1/3 of the national number trained. This year locally, 45 veterans in crisis have been brought to the Albany VA Emergency Department. 7 veterans brought into the ED were considered saves as they were in extreme distress or grave risk for self-harm. Since March of 19, a total of 229 veterans have been brought to the ED by Albany's ED by local law enforcement and community partners. The HRO principles that we've relayed this to is commitment to resilience. Our veterans are resilient, and so is our staff in dealing with them, and deference to expertise, because the VA brings expertise for veterans, but we're also leveraging the expertise of our community partners to assist us and help our veterans.
Yeah,
Thank you.
Thank you, Chief. Every day I'm reminded of the great work that has been done and what you and Courtney did when you started this program. It is spread across the country. It is recognized in VACO, and I recognize personally the work that you're doing. And those veterans that have been brought into the ED, our staff have been amazing in giving them the appropriate care necessary. Chief, as you know, I'm very active in the community from where I come from, and recently I had conversations with the Malta Fire Department, and that's a volunteer fire department, but many of the members of that department are veterans. They have recently gone through a very serious unexpected death within their department, and when I talked to them about the services that perhaps, because there are veterans there and veterans are leading that volunteer group, they were very interested in having someone come and talk to them. So I don't know if you wanted to reach out to the Malta Fire Department and see what we can offer them. I think that it may help.
I would love to do that, ma'am. I can get the contact information from you sometime today. I know in the past year, Albany Fire had a loss through suicide, and I know we reached out to them, and our mental health staff provided postvention for them on that.
Yes.
So I can get with you and then coordinate with Dr. Breen and Dr. Payne for that.
Absolutely. And it was a suicide that they experienced. And to see all those men in uniforms fall to their knees was quite disturbing. And it seemed like the community services for those veterans weren't there. So when I talked about the services that they offered, many of them were very thankful. So thank you, Chief.
I can get that contact from you later, ma'am, and then I can work on getting that scheduled.
Sounds wonderful. Thank you.
You're welcome.
All right. It's always important that we demonstrate our safety stories, whether it's sharing what we do every day or whether it is demonstrating one of the pillars. But I think that overall, this story reminds me that our strongest pillar it's about the veteran. And so again, starting off the morning with thanking Amy, all that is being done by every member during Public Service Week or every week that we work here, it is all about the veteran, and that's what Albany does. So I'm going to end there. Dr. Howard's going to start with his intermission and going to the second half. Thank you all. Have a good
Thank you.
afternoon. Hope to see you at the tree planting.